Across the world, more than 93 million Nigerians are reported to be living with one form of disability or the other, which can either be physical or developmental, such as an intellectual disability, autism, or a speech disorder. Without appropriate support, these conditions often limit these children's ability to benefit from the educational and social opportunities in their society. In a bid to ensure a trauma sensitive and all inclusive government for children living with disability in Nigeria, a non governmental organization has organized a 2-day training on basics mental health care and sexual and reproductive health rights for teachers and caregivers of students with disability in Abuja, the nation's capital. Clairview's Gloria Atta was there and now tells us more.
In Nigeria, over 27 million people are living with one form of disability or the other, which can either be physical or developmental, such as an intellectual disability, autism, or a speech disorder, with 5 to 7 million of them being children. Without appropriate support, these conditions often limit these children's ability to benefit from the educational and social opportunities in their societies. Reports show that at least 95.5% of children with disabilities in Nigeria are out of school and have low knowledge of sexual and reproductive health issues, and the few who manage to be in school are oftentimes more likely to experience violence, neglect, and other forms of abuse, which are detrimental to their general well-being. A non-governmental organization, Jella's Development Initiatives, believes that schools and teachers have a role to play in rewriting the narrative and promoting mental health among students living with disabilities. Speaking at a 2-day training on basic mental health care and sexual and reproductive health rights for teachers and caregivers of students with disabilities in Abuja, the Chief Executive Officer and founder, Angela Ochubaye, said it is important to educate teachers on mental health issues so as to enable them create a trauma-sensitive environment for children living with disabilities.
We're basically having a 2-day training for teachers working with students with disabilities, specifically GGSS, GSS Kwali and GSS Kuje. These are two inclusive schools in the FCT. Training them on basic mental health for them to also understand how to create a trauma-sensitive environment for their students, and also giving them trainings regarding sexual and reproductive health rights of the students with disabilities. It's been a project that we've been funded by the Lillian Funds in Netherlands through the Leprosy Mission in Nigeria. Presently, we're working with about 40 teachers and caregivers of students with disabilities in, of course, public secondary schools.
Facilitators and participants at the training, while lauding the initiative, called on the federal government to ensure that mental health issues are incorporated into school curriculums for better delivery.
One of the things that I think is very important when it comes to creating inclusive and a trauma-sensitive school environment is to develop curriculums that are specific to the disabilities that people are experiencing. Because I'm not sure if we have curriculums like that, because if you have curriculums like this, they help to create guidelines that would help operationalizing some of these policies, some of these documents, some of these curriculums that can help provide, support for the teachers and authority for the teachers to be able to create the type of environment that these people need.
Based on our report, I think this should reflect in policies. Thank God we already have something around the mental health policy in Nigeria now, being imbibed. So I think implementing these things is where we may have a little bit of challenge, but we are moving. It's not so much, but it's gradual. So I will call on the government to also try and see that we are implementing these things and it's being monitored.
Honestly, I must say that the training has been very, very impactful, because I learned a lot, not only as a person with disability, also as a teacher interacting with students with disability. I learned how best to interact with my student, how to also make other students, the other students who are not living with disability, how best they can relate with students with disabilities.
So empathy is one of the things I'm taking home. In fact, I need to show more empathy, and this empathy boils down to putting the children in my own, as in putting them in my own shoe. Like if they were the one, if I was the one that had this problem, how would I feel? How would I communicate? This will help me to, in fact, come down to their level and attend to them specially.
It gladdens my heart that people who are not special educators know much about children with special needs, and that is a way forward. And I want to say that if government can encourage and empower people, I think inclusive education will come to stay in Nigeria.
The two-day training also featured interactive sessions among stakeholders at the event. Gloria Atta reporting for Clearview News.